Thanks for staying with us. It seems COVID-19 cases are on the rise again in South Africa, and this has led to concerns that the country may be entering another wave of infections. But hospital admissions have decreased, and people are still urged, though, to take precautions and, of course, encouraged to vaccinate. Let's get more details now with Dr. Sibongile Walaza, NICD's Senior Medical Epidemiologist. Dr. Walaza, thank you so much for your time this afternoon. Now, when one looks at the South African coronavirus website, it looks like numbers are starting to increase, and it looks like they started increasing in September. How are things looking?
Thanks for the opportunity, and thanks for inviting me to come and talk about this. Maybe before we talk about the number of cases, it is important to put everything into context in
Yes.
that the testing rate has really gone down. So the number of people that are currently being tested is much lower than before. And therefore, this does, complicate how we interpret the data. But as you mentioned, the percent of those that are tested, the percentage that's testing positive is slowly increasing, and it's been increasing over time. However, even the magnitude of the increase is much lower than what we've experienced or what we've seen previously. And then also that this increase, though, in percentage testing positive has not translated to hospitalization or increases in hospitalizations or in deaths. So meaning that chances are patients are mostly mild cases, and therefore maybe some of them are just, presenting with symptoms but not going to seek medical attention or for testing.
Okay, so then, with the testing rates, as you say, having gone down, it may seem like there's also maybe concerns, maybe like there might be underreporting here, or people that are walking around possibly with COVID but opting not to test.
Yes, from what we're seeing is that, we suspect, or I think we know that, there's quite a number of people, many more people that are out there that have got COVID, but then the symptoms are mild. I think also it talks to the high level of immunity in the communities that, now, so even though people get COVID, but they're not sick enough or severe enough to go and seek medical attention or seek hospitalization. I think, which is also a good thing that even though we're seeing some increases, but this is not severe cases, and therefore not impacting on the healthcare systems.
Yeah, it sounds like a bit of a relief, Doctor. And is it a new strain? Has a new variant been detected, or are we still dealing with the previous variants?
So, as part of surveillance and also monitoring during the pandemic, so we do look at the data, in real time. And as far as we know, there's no new strain that's been circulating. So it's mostly, currently, most of the cases that from genomic surveillance is that they are it's the BA.5. So that's the Omicron. And again, also that's also linked to testing, right? So if the testing rate is low, so it means then the number of cases or positives that are going to be sequenced are going to be lower. But from what you're seeing now, there's no new variant that's causing any concern at the moment.
I suppose then the concerns that it could be a sixth wave may be too premature, if I'm listening to what you're saying.
Yes, at the moment we're not seeing any clear resurgence. Yes, there's been some increase, but we're not calling it a wave, and it is. But we do acknowledge that the signs are that there is increased transmission in the communities, but this is not. We're not saying we are in the sixth wave. No, that's not what we say.
And I remember when we were seeing some of the different strains, we would get data that zones into various provinces to see which are some that are experiencing more infections than others. Have you done some zooming into the data, and what is it telling us?
So we've got, so obviously, we look at the data holistically, and then if there's any concern in what we're seeing, then we're able to zoom down. But at the moment, for example, we're saying it's mostly the increase where we're seeing the increase, right? We're seeing the increase where from the provinces that has got more testing, so from those provinces, and mostly it's the most populous provinces like the Gauteng, KwaZulu-Natal, and Western Cape. But for at the moment, there's really been no indication for us to have concerns to say we really need to go, to look at the district level and all of that.
And Doctor, just before I let you go, there's quite a number of people that are walking around with the flu, and some of them opting not to test, saying that it's just the flu, but others are saying they are so worried that there might be a new strain of flu that's currently doing the rounds. What do we know about the flu now?
So, talking about flu, which is the illness caused by the virus called influenza. That's one of the respiratory viruses that are circulating currently. We've just been through an influenza season. Actually, for this week, we did call off the season because based on previous thresholds and what we're seeing, we're able to say, are we in the flu season or not? But then even though we're outside flu season, doesn't mean that we're not going to get people who get infected with influenza and therefore have flu symptoms or have flu. But also important to say that, again, there are also other respiratory viruses that may cause common colds or symptoms that are flu-like, that are not necessarily flu, but I think it is a combination of, different respiratory viruses that are in the population. And again, in terms of the current influenza that we're seeing now, it's not a new strain. What we're seeing is what we've seen previously, and it's been, it's not something that we're worried about or concerned about.
All right, Doc, thank you so much. Do appreciate your time this evening and for just putting us in the picture about how things are looking. That's Dr. Sibongile Walaza, NICD's medical epidemiologist.